Well, hello, my name is Joanna Frageorgia, and I'm a public affairs specialist at AAA Northeast. I am joined today by Amy Donabedian, who is a certified driving rehabilitation specialist and occupational therapist at Spaulding Rehabilitation Hospital. So welcome. Thank you so much for joining us, Amy.
Thanks for having me.
So over the years, we've received so many calls from members with questions about the driving evaluation process and, whether it's for themselves or a loved one. So this conversation, we really want to just answer some of those common questions and enlighten the process of driver evaluations in the state of Massachusetts. So firstly, when we're thinking about this topic, I was wondering, how do most referrals come to you?
Referrals are usually from the doctor, and also within our own hospital, therapists will talk to patients about the driving program and, often say to them, before you get back to driving, make sure you talk to your doctor about getting a referral to the driving program. So it's, just more of the medical team, but the doctor has to write the order in order to initiate the evaluation.
Absolutely. That makes a lot of sense. And then for you and your role, what training does the driver evaluation staff have to do what you do?
So I'm an occupational therapist, and any occupational therapist that is trained in the areas of cognition, perception, vision, working with the neurological population, can perform a driving evaluation if they've had a mentor sort of take them through what it looks like. I also went on to get additional training after working as an OT generalist doing driving evaluations for probably 15 years. And then I went on for my certification and advanced training. So that's a national exam that, deems you, when you pass it, a certified driving rehab specialist. There's many hours required to complete that training. So lots of times people, just spend many, many, many years working towards it. So it's okay if you see someone who is an occupational therapist. You don't have to be a certified driving rehab specialist. In order to perform, to work in the vehicle with clients, you do need to be a certified driving rehab specialist.
Great. And with that, can you explain, take us through the process of a driver evaluation?
Sure. So at Spaulding Rehab Hospital in Charlestown, it's a two-part comprehensive evaluation process. The first part is a pre-driving assessment where we spend 2 hours doing an intake with the patient. So that's patient interview style. We look at vision, perception, cognition, basic understanding of the rules of the road, their physical abilities such as range of motion, strength, coordination, sensation, brake reaction time on a computer, and visual processing speed, which is also computer-based. So some of our tasks are paper pencil, some are interview style, some are on the computer. Whatever limitations a person presents with, we can work around and sort of find a way to make it work for them. Sometimes patients who have aphasia, it can be very difficult because they're unable to express themselves. So sometimes that can be difficult, and we end up having to just move them to the on the road portion to really see if they're able to drive or not, because the in-clinic evaluation just isn't as accurate as it should be. We also have the ability to use interpreters to help us if there's language barriers too.
Yeah, that must come in handy, I'm sure. And then what would you say would be the differences between someone going to Spaulding in comparison to the RMV?
I think the main comparison is that the RMV focuses more on the maneuvers that are involved, the same testing that's involved when you get your license as a teenager. So backing up in a straight line, 3-point turns, parallel park. Those are some of the top maneuvers that I said that one. And then our testing looks at your ability to operate the vehicle. So gas, brake, and steering. Are you in control of the vehicle? Your awareness and interaction with the environment. So stop signs mean stop. If you're seeing pedestrians, are you aware of them? Are you just going by them, or you're stopping to motion them to pass. And then also your overall carryover of the rules of the road. So it's more looking at, are you safe to drive? It's more of a, I'm not going to say relaxed, because most times people are very nervous, but it's more, our goal is to help people stay driving if that's what they want to do. And we aim to try to help them maintain their independence. So if there are things that we can suggest to make driving safer or easier, or some modifications, then we're going to suggest them. Whereas an RMV test is just the maneuvers, you pass, you fail. Sometimes they fail you and you don't have a chance to retake it. So there's also a risk involved.
Yeah, I'm a former Massachusetts driving instructor, so I can attest to that. It is a little nerve-wracking when it comes to that test, and there's a lot of pressure, I think. But I know, we get questions from our driver training school, kind of about, those people who might need extra help or things like that. So I was wondering if you could maybe explain the different outcomes of somebody who would go through a driver evaluation at Spaulding.
Sure. So if we start back at the pre-driving assessment, the clinical piece, if somebody does well, we would then schedule them to move on to an on-the-road test. Sometimes those people need more therapy before they're ready. We may suggest physical therapy, occupational therapy. Sometimes we suggest, because of a visual deficit, we need more information. Do they need to see a neuro-ophthalmologist? Is there a field cut? So sometimes it's a referral back to a medical specialist that can help us figure out what's the next step for the patient. Another suggestion or recommendation would be that they did not pass the clinical and that they need to retire from driving. And then there's a lengthy discussion about alternate means of transportation. If they need us to reach out to family with their permission, we're able to do that to help them set up support and manage how they are going to stay active in the community and make sure that they're socializing still and doing the things that are important to them. So then if that person that passed the clinical moves on to the road and then they do well on their road test, then we're recommending that they resume driving. Sometimes, if it's been a long time since they drove or there's a medical impairment, we suggest lessons. Lessons can be based with a local driving school if it's something that a certified driving instructor could help them with, or sometimes they need more specialized lessons. So it might have to be with a certified driver and rehab specialist. And that can be, a little bit more costly to them. And sometimes they fail on the road, and then we're having that retirement from driving discussion again. And some of our clients that come through us are looking for adaptive equipment. So that would be, a left pedal accelerator for either an amputee or a stroke patient, hand controls for a spinal cord. So then there's recommendations and training for that population as well.
That's, I think, really important for people to understand that process and the different outcomes that, they're going to happen one day for all of us. And I just wanted to mention that AAA Northeast has created an online resource called Key Timing to provide it's called Key Timing.
Oh, Key Timing.
So it's a resource to provide older drivers and their caregivers with helpful guidance to prepare for driving retirement. So within that website, there's an e-learning module to help prepare caregivers for that difficult kind of awkward conversation that might need to occur about driving retirement. And then also some information about how to find out about driver evaluation resources, and then also just a comprehensive list of kind of like what you were talking about, transportation options and services available in the AAA Northeast territory. So if anybody is looking for more information about that, they can find it at AAA.com/key timing. And that definitely is a great resource for anybody who's interested or needs that extra help with that. Now, Amy, If people are looking for more information about Spaulding or what you do as a rehabilitation specialist, where could they go?
So if you're looking for a driving program, you could go to the Spaulding Rehabilitation Hospital website. The network has several sites. Cape Cod has their own, CVRS has their own driving program. I work in Charlestown, so if you're looking for me, you can certainly go to our website, and they can send you to my voicemail or give you my email so you can access that. And then if you're looking for, if you're out of state or you want to recommend this to your sister or brother, relative out of state, you could go to adad.net, ADED, which is the Association for Driving Rehab Specialists, and look for a provider through them.
That's super helpful advice, Amy. And I know many of our members will be really appreciative about this conversation and just so much of the information that you've provided. So thank you again for joining us today.
Oh, thanks for having me.